Good afternoon, everyone, and welcome. I am Vanessa Cornell, a board member for Exposomics and Children's Environmental Health at Mount Sinai. And I am so thrilled that you are joining us for today's lunchtime chat in our Environment and Health series. I am particularly excited for today's discussion with Dr. Chris Gennings. I will introduce her shortly. But if you've tuned into earlier talks in these series, you'll know we seek to share the most cutting-edge research and advice on how aspects of our environment affect our health, from the air we breathe to where we work and play. So when we talk about concerns in the environment, we often talk about what we should avoid, like harmful chemicals, stress, and other environmental factors that can have adverse effects on our bodies. But today, I am hoping with Dr. Gennings' help, we can take back some control and talk about ways to protect ourselves through the foods we choose. How can we be proactive to create greater well-being through choices we have the power to make? So a little bit about how the program is going to run today. Dr. Gennings will present for about 25 minutes, and then we will have about 20 minutes for questions. I definitely have a lot of my own, but I know that many of you will have questions also, and we really want to hear them. So please note that if you do have a question, the chat function is disabled, so you should enter it in the Q&A function. We will try to get to as many questions as possible. Feel free to send them throughout the presentation if something that Dr. Gennings presents sparks a question, and then we will gather them and again, get through as many as we can in the time that we have. Okay, without further ado, it is my great pleasure to introduce Dr. Chris Gennings. She is the director of the Division of Biostatistics in the Department of Environmental Medicine and Public Health at Mount Sinai. She is an expert in mixtures analysis, developing novel methods to look at many exposures at a time. So traditionally, environmental health studies have focused on assessing risks relating to a single pollutant at a time. Think asbestos, lead paint, BPAs. This, however, does not reflect reality as we are constantly exposed to multiple pollutants at once. This is super interesting and advanced work that I really believe is going to create real change in the world and how we protect ourselves and our families from potential environmental risk. So Dr. Gennings is involved in so much of this innovative work coming out of the Institute for Exposomic Research, including studies examining learning outcomes in children, autism, Crohn's disease, ALS, cancers, and many, many more. Her work impacts so many people and intersects with research in so many major disease areas. Super exciting and groundbreaking. Dr. Gennings has been at Mount Sinai for nearly a decade and previously held positions at the Virginia Commonwealth University, where she received her doctoral training. You can tell why I serve on the board of the Exposomics Institute. I am so passionate about how forward-thinking, impactful, far-reaching, and potentially revolutionary this incredible research is. We are so lucky to have her with us today. And with that, Dr. Gennings, please take the stage.
Thank you very much, Vanessa. What a kind introduction. Let me see. I hope you can see my screen. Is that true? Yes?
Yes.
So like Vanessa just said, the Exposomic Research Institute is so good at thinking about big pictures of the holistic view of human health and disease based on exposures. What's in our world? What's around us? So it could be exposures, from environmental toxins. It could be lifestyle things, behavior things that affect our health, but it can also be our diet. From the beginning, we're very easy to say, nutritious eating is beneficial to human health. That's sort of a given. But the point I come into that is, well, how do you actually measure that? We kind of know what it is. We know what it ought to do, but how do we have a metric? Can we develop a metric that actually measures the nutritional value of our diet? In ways that we would anticipate it should. And when we do that, then we can start studying diet versus like what Vanessa was saying, environmental toxins. So we've developed a nutrition index. It's called My Nutrition Index. I'll explain that and give you some examples of studies that it's been used in. And then I'm going to turn back around and say, well, what about diet in connection to the mixture effect of environmental exposures? And there, I don't want to just stop with one. I want to go to many. So I'll demonstrate there a little bit. And so that's really it in a nutshell that I'm trying to get to today. I hope I can do that in a way that is helpful to people to understand what we're trying to do. So we're really focusing on a research question where we can balance sort of good nutrition with the adverse effect of environmental exposures. And like Vanessa said, decades of work in environmental exposures, it can get a little depressing because it's so hard to change exposure patterns and things. But good nutrition is something that individuals really can maybe take hold of in their wellness program and that. Whoops. Okay. So, creating an index for overall nutrition. I want to start by comparing to something that's already out there, and maybe by showing the contrast of that, you'll understand where we're sort of going with this. There's something called the Healthy Eating Index that's created by U.S. Dietary Guidelines. I think it was originally joint work with the USDA and the National Cancer Institute, but it's largely, if you can read the little green square there, it's kind of hard to read that, but it's largely looking at 13 different components. 9 of them are focused on adequacy, things like, whole grains, greens and beans, total vegetables, things like that. And then there are 4 in moderation that have to do with refined grains, sodium, sugars, saturated fats, things like that. The thing about HEI is the motivation of it is it's a measure of how Americans follow dietary recommendations. It can be used in the food stream. So it can be used to evaluate a community food environment. It can be used to look at a school lunch program. It can be used also for individuals. But the motivation of that is different than where we started with the My Nutrition Index. So My Nutrition Index, like I say, is a subject-specific index. It's meant to be based on what's right for you, what's right for your health and your lifestyle and your body size and your activity level and so many other things, maybe some disease things that you have to suffer from. It incorporates dozens of macro and micronutrients. I'm going to stop here because I always say this story because I think it's remarkable. There's so many diets out there now that are just based on single components, like, the Atkins diet back in the day where people were saying, oh, I can't eat these carbs. And, I used to know a man who lost a ton of weight on the Atkins diet, but every morning for breakfast, he had a pound of bacon and a Diet Coke. That can't be good for you. And so, the idea to my mind about good nutrition is an overall health, overall dietary, well-balanced meals. And that's sort of what I wanted to incorporate in the My Nutrition Index. And that's when I say it incorporates dozens of macro and micronutrients. I'm not trying to just focus on a single component of nutrition, like calories even, or like sodium, or like things like that. So it's a personalized nutrition index. And it's based on things, like I say, in your lifestyle, what you like to eat, perhaps. I mean, that might need to be changed a little bit, but what you like to eat, activity levels, your health-based dietary restrictions. Do you have something, like Crohn's disease or IBD patients that may have to have changes in their diet based on their conditions? So what's right for me in terms of a personalized nutrition? It turns out that the dietary nutrients, the optimal levels of these as described by the USDA guidelines, include things like calories, fat, protein, carbohydrates, vitamins, and minerals. These things depend on personal characteristics, and that's what I'm really trying to go after. How old are you? What's your height, your weight, your body size? What sex are you? How active are you? Do you have medical conditions? Do you smoke? Behavior things like smoking, or do you drink? Are you pregnant? Are you lactating? Things about your lifestyle. You might be a bodybuilder and you need a high protein diet. These are things that are very specific to the way you live your life, and that's what this My Nutrition Index is meant to try to evaluate. So the whole point is the perfect diet for one person can be very different for another. So there is no one size fits all diet. So here's a little demonstration of that. So we talk about the Mediterranean diet, how beneficial it is, and I do agree it's a beneficial diet. I found online, and I forgot to put down where I found it now. I can't find the reference for it, but this little table here is actually a typical suggested daily Mediterranean diet. So you see it has, really good things in it, from, the olive oils, the wheat toast, et cetera, vegetables, things like that. But according to the My Nutrition Index, and this is what I'm trying to highlight here, is if you're a young man, moderately active, average size, then this is a good diet for you. Your My Nutrition Index, the MNI, is a 95 on a scale of 0 to 100, where 100 is good, is the best. But if you're a middle-aged woman, small, not very, active, you're kind of sedentary, then the index for that same diet with those proportions there, or portion sizes, is a My Nutrition Index of 69. But now what if you're the same middle-aged woman, petite, sedentary, but you've got some kind of chronic condition and you have to live on a low-fat diet? Then that is even worse for you. So that's the point, is that can we come up with an index that is able to incrementally change, depending on, are you in the IBD flares, that sort of thing, or just based on your lifestyle choices. So the My Nutrition Index, then, it's calculated from, for researchers, dietary recall. What did I eat yesterday? Or we can have food frequency questionnaire. How do I typically eat over the last month or over the last 6 months, whatever that time frame is that's designated. And then now, of course, there are a lot of dietary tracking apps that are out there. But the point is that you need to link your food to nutrients. And so there's this really fabulous database called the FNDDS, which is linked to hundreds of thousands of food items. And these are branded. Some of them are branded and some of them are just like a tomato. But they're linked to what are the nutrients. And this is a wide range of, dozens and dozens of nutrients on 100 grams of that food item, right? And then, of course, your portion sizes, you're not going to eat 100 grams, you might eat 2 grams, or you might eat a half an ounce, whatever it is. So then the nutrients that are linked to that food source, to the nutrients, then that can be calculated down based on the total amount that you eat. So that's the basis. Those kinds of data sets are the basis for the dietary tracking apps that are out there. And it's also the basis for this My Nutrition Index. Right now, we're working on a web-based app for researchers. The first phase is sort of in the beta testing version now, but where we have the calculator that if you give us a spreadsheet of nutrients for your patients or your subjects, then we can calculate the My Nutrition Index and some sub-indices, which I'll show you. The next phase that we're working on is the tracking part of that. So people can actually say, here's what I want to eat or what I have eaten, and this is the calculation. So the idea is, if we find this metric, a My Nutrition Index, say, that is related to improved health, then maybe it would be an index that people could use to help them make decisions about how to improve their diet, just on as a unidimensional construct. It's just a single direction thing that you can track over time. So I'm going to show you several studies that include the My Nutrition Index, just really as a way for you to say, well, does it work? That's what I'm getting to. So here's a study that's recently come out with some colleagues of mine. It's a cross-sectional study using what's called the National Health and Nutrition Examination Survey, the NHANES surveys. It's from taken data from 2007 to 14. And these are, there are 2 24-hour dietary recalls there that we used as the basis of this, as well as some covariates that you can find in more details in this Busgang paper. But so the models are going to be adjusted by covariates, age, sex, race, et cetera, as you see there. And we're going to look at different health outcomes. How healthy do I rate my own health? Am I depressed? So this is a cross-sectional analysis, where these things are happening at one point in time. Is this person obese or not, based on a BMI greater than 30? And have they had current or past cardiovascular disease? So when we do that analysis, we do something called an odds ratio. You may or may not be familiar with, but an odds ratio is looking at what's for a unit change in, say, here I say a 10-point change, so I make a 10 points on the 100 scale of MNI, 1 unit. If I go up 10 points or down 1 point, let's say 1 unit up in the My Nutrition Index, am I more or less likely to be obese? Am I more or less likely to have self-reported health? So the odds ratio of 1 is saying there's really, it didn't change. It didn't have an effect. But when we see an odds ratio less than 1, like in the obesity, then we could say for a unit change, which is 10 points on the My Nutrition Index, are you more likely to be obese? No, you're less likely to be obese because this is less than 1. The p-value here and this confidence interval is largely just saying, is that a statistical significant, important result? And yes, it meets that guideline. A self-reported health, am I likely to determine myself to be in a healthy condition? Yes, if people who eat more, a higher level as measured by My Nutrition Index, they are more likely to have self-reported, to be the healthier side in the self-reported health. And for depression and CBD, it's the other way. For a unit increase, you're less likely to be depressed or you're less likely to have cardiovascular disease. The other thing that when you have an index, you can actually look at a distribution. So here's kind of interesting. We can say, here's the My Nutrition Index from 0 to 100. The pink here are the women in the study. So this is that same NHANES data, and the blue are the men. So we can see generally then, based on the My Nutrition Index, men tend to have lower nutritional value in their diet. And then on the right side here, this is a comparison of smokers and non-smokers. So the non-smokers, the blue or purple, whatever color you say that, tend to have a better, whether it's statistically significant or not, I'm just visualizing what that looks like, a better My Nutrition Index distribution, higher values there. Now, this is kind of an interesting little bubble plot, but here I just wanted to plot, well, what about the healthy eating index compared to the My Nutrition Index? And I think this is a really interesting relationship here. You can ignore the circles. The circles have to do with the design of the study, the sampling weights and things. We don't need to worry about that, but the data are sort of here. And the green line is just a smooth sort of average values over the My Nutrition Index. But what you see is that, for higher levels of My Nutrition Index, we do see an increase in the HEI, but the My Nutrition Index is actually more discriminating in the lower part here, right? The total, the HEI value here is pretty flat in this whole sort of backside range of the My Nutrition Index. So the My Nutrition Index is picking up things that the HEI is not in that lower range. Another thing that we've done is I actually had a very fun time working with a couple of people in the IBD clinic here. One is Laura Manning, who is a dietitian, an IBD dietitian, and she's actually working with people who are coming in and saying, I have IBD. Here's my pre-consultation diet, so she can take that to nutrients. But then she makes a suggestion to them, well, maybe incrementally you can change some of what you like to eat, you can continue to eat, but let's change this or add this. And she's fabulous in the way she does that. But her idea is you got to be incremental about this. So what we wanted to do is use her as the gold standard and say, well, does the My Nutrition Index and these sub-indices that I'll show you here, do they track with what she says in terms of her suggested diet? So this is not, we don't know if the patients actually ate this way, but this is what her suggestion is. And so the index does track with the way she said this would be better for you than the way you were coming in. So the lines that you're seeing here are 5 different patients, and the My Nutrition Index, and then the sub-indices are an electrolyte index, a mineral index, an energy ratio. So are you hitting a total calories relative to target calories? But the macro index and the vitamin index. So we see in all of these, the electrolyte, mineral, macro, and vitamin index, those 4 indices, we do see that patients came in and with Laura's suggestion, suggested diet, we do see an improvement in the index. And that's exactly what we were interested in. And the same thing, of course, with the total, the My Nutrition Index. So that was a way of sort of validating the index with, a real dietitian. So now this gets back to what Vanessa was saying about the toxins. So this is a pregnancy cohort in Sweden. It's called Selma. And we published this paper where we looked at prenatal nutrition. So this is like 20 weeks of pregnancy nutrition based on food frequency questionnaires. And then we looked at the child's IQ at 7 years. Now you think about, okay, somebody's pregnant, the brains are developing right at that time or in this period of time, whatever. Maybe nutrition does have an important impact on children's brain development. So we evaluate the My Nutrition Index, working with people linking from the food frequency questionnaire back to actual estimates for nutrients. And then we looked at the regression model there. So these are models that are adjusted for a lot of different variables, because we don't want to have this confounding problem in the work that we're doing, but we think we properly adjusted for that. But this is a three-dimensional figure that is takes the My Nutrition Index, and you see here's the distribution of the index, which looks pretty similar to what we saw from the NHANES, which is kind of interesting. But for these women, then the question is, so you see here on the right-hand side is log BPF. So BPF is sort of like bisphenol A. You may know some about that. So if you take the concentration from urinary values of these women during pregnancy, you can see that there's a tendency here. If so, for let's just take this edge here because it's easier to look at. But for whatever level of My Nutrition Index, as you increase concentrations of bisphenol F, you see a decrease in 7-year IQ, right? Now, what's really interesting is though, but at the same time, in that same model with those same women, if you increase the My Nutrition Index, we see an increase in IQ. So you might not be able to do a whole lot, back in terms of your exposures, but you can improve the way you eat, possibly, right? We don't know that from a research perspective, but we can think of that. But we do see that as the exposures get higher, it's a little bit harder to counteract them, right? So we don't want to just give up on trying to reduce exposures, but for moderately to low concentrations of these exposures, we do see an impact there. And it is a significant P less than 0.009, where 0.05 is sort of the guide. We need it less than 0.05 to show it's statistically significant. Okay, so now, but so here we've got this My Nutrition Index, we've got these exposures, but as I'm trying to say here, you can eat well, but there's a whole lot of arrows pointing to these people right here, right? There's a lot of different exposures, from food packaging to cleaning to different fabric, flame retardants and things, different electronics, different plastics and things, and building, all kinds of things may impact. Many of these are endocrine disrupting chemicals, which is really, I think, a huge problem. Thousands of endocrine disrupting chemicals in our environment, some that are forever chemicals, they call. So the point is then, we don't want to just look at bisphenol F. We want to look at these together. So I'm not going to go deep into this, but I do want to give you some sense of, well, what would we do to think of this as a mixture? So we published, Caroline Carrico, I'll show her a little picture in a minute, but she was one of my dissertation students when I was in Virginia. And we published this paper where we sort of started the development of this weighted quantile sum regression, which is a way of saying, let's take correlated exposures and put them in a single weighted index where it's an empirically weighted index. And so I kind of wrote it out here. The WQS, it's a weighted quantile sum regression. So it's a WQS index, and it's a weighted index of the quantiles of concentrations of these chemicals. So we do a lot of biomonitoring studies where we have urinary values or blood levels, or it could be, from whatever sources in the tissue, whatever. But those concentrations, if you take them and put them in quantiles, so you quartile them or you decile them, so that we're not worried, so that we can interpret the weights across this weighted index. And we're going to estimate those weights. And so the details of that, we don't know, we don't need to go into the details of that here. But largely what I'm trying to get you to think about is that this WQS index is actually a metric for the mixture effect of these endocrine disrupting chemicals together. So just because you're exposed to chemicals doesn't mean they're bad, but there are some that are bad. So can we identify the bad ones through those weights, create an index, and then use it as sort of a measure of the mixture effect, the joint action of these chemicals working together towards whatever health outcome you're looking at. So we had a postdoc, Eva Tanna, who did some work that extended the work here of Caroline Carrico and I. But then more recently, I've extended what Eva did into a stratified analysis. And so this, I'm almost done with this, but I just wanted you to get some visual of what we're talking about with this mixture effect thing. So this is a model, the WQS, where we've taken, I'm not going to go into all the details, but we're creating an index, we're estimating the index from the data, And what we're allowing here is for different indices, different weights for boys and for girls, because you might think they should be different. These are endocrine disrupting chemicals. Boys and girls have very different endocrine systems, right? So, and in fact, you see the weights here. So the dashed line is sort of the equi-weight part. And so things that are sort of more to the right, so in that direction, and you notice this is still a positive scale going to the left for the boys. But so if it's beyond the dashed line, then that's identifying a chemical that might be of concern. Some of these, when it's underbar CRT, they're creatinine adjusted for urine dilution, things like that. Others are measured from the serum. But this is 26 different chemicals that we've allowed to have an impact, or we're trying to estimate the impact on 7-year IQ, prenatal exposure, 7-year IQ. And so you see, the distribution for the boys really is the things that are the higher than the dash really is different than in the girls. And so this index allows that to happen. This little figure over here is saying, we are exposed, these women were exposed to all kinds of chemical classes. This, you probably can't read this, but it's phenols, this is phenols, this is the plasticizers, like the phthalates. These are other short-lived chemicals. And then these are the persistent, the brown ones are the persistent chemicals. So the point is, these women, as all of us, are exposed to a broad class of chemicals, many different kinds of chemicals. And so, we need to think really broadly about not only how to get rid of some of them, but to for guidelines and for regulatory stuff. But we need to take into account this mixture, this relevant exposures. And so there's a whole other seminar we could give on that. But anyway, I just want to make that point. But in this analysis, what I want to do is draw your attention to this top one here. And this is saying, we're allowing for different weights for boys and girls. We're also allowing for different beta coefficients, different slope parameters, different association parameters between the WQS index for girls and boys. When this sort of range, this 95% confidence interval, covers 0, then we say, well, that wasn't statistically significant. But what we see in the boys is there is a decline in their IQ associated with their prenatal exposures to these chemicals, right? And where the weights are identifying the ones that are particularly the ones that are bad acting. But at the same time, look at the My Nutrition Index. It's significant and positive. It does not include 0, that confidence interval, meaning that the My Nutrition Index is a metric that was able to say for women who ate with higher values of My Nutrition Index, that during pregnancy, their children had higher IQ. Now, this is an association study. This is not a causative. We are not doing causal inference here. We'd have to be really careful about, causal inference is a whole nother issue in terms of confounding problems and things. But we do see associations this way, and it might be as we anticipate in terms of the developing brain during pregnancy and how important good nutrition is. And so the My Nutrition Index may be an index that can pick up that in terms of a measure of nutrition. So in summary, then, we do have, I put both of these pictures back on here. We do have this balance between good nutrition and all the exposures that we have. But as Vanessa said, that was going to be my final point. She stole the show right there. It is something that I think that individuals can try to gain to achieve better nutrition. That's not to say every single day you eat perfectly, but if you have that as a goal to say, I really do want to eat better, and how do I do that? Hopefully something like My Nutrition Index might help you. It might be a metric where you could say, yesterday I was a 48, today I'm a 62, and tomorrow I'm going to be a 90. It can be a motivator if you are motivated by those kinds of, scales and things like that. It's going to be a long time before we get rid of these environmental exposures, but I think we should keep trying. I'm not saying don't give up on that. We need to keep working in that direction as best we can. But the nutrition side of this hopefully is something that people can think about to try to improve not only their diet, but during certain times of your life, like when you're pregnant, we might be able to improve developmental and health outcomes for our children. So I appreciate, I should give credit where credit is due. This is just a last slide of, you need a team when you start working like this, and we have a fabulous team at Mount Sinai. Here's Caroline's little picture. She was the original work that I worked with on the WQS. Golub and Paul and Stefano are very helpful with extending methods, and Eva as well, extending methods of the WQS. So I appreciate the time, and thank you very much for your attention. And I guess I should stop sharing my screen now, but I'm happy to try to address questions. Thank you very much.
Thank you so much, Dr. Jennings, for that wonderful presentation. We are going to move right into Q&A, but before we do, I want to make sure that you, our audience, know about our last webinar in this series. Next Wednesday, Dr. Doug Walker is going to discuss the harmful effects of microplastics and how we can reduce exposures. As Dr. Jennings said, yes, we can control our nutrition, but we still need to focus on reducing exposures. If you are interested in meeting and learning from scientists like Dr. Jennings, I would encourage you to explore our new website. Contact us, learn how you can get more involved. We are seeking nominations for our executive board, which I sit on. I can tell you it's absolutely fascinating. The executive board drives the work of the Institute philanthropically and builds community engagement. So also, if you have any questions, environmental concerns, even in your own home, I encourage you to reach out. Our scientists are here to help. They have a wealth of knowledge and great advice. So I'm going to move on to the questions. Again, if you have a question, please put it into the Q&A. We'll get to as many as we can. First, I want to start on a really practical level with you, Dr. Jennings. I imagine that you are pretty deliberate in your food choices. You have a lot of information, right? You know a lot. And however, I love the idea of becoming a little bit more sophisticated and understanding that it's not one size fits all, right? It's like the food pyramid of yesteryear just doesn't quite capture it, but that can also feel a little bit overwhelming. And so it's sort of a two-part question is, how do you start to evaluate what's right for you? Are there things that apply sort of across the board to everyone in terms of approach? And maybe you can use yourself as an example of how you sort of generally approach, given everything that you know, your choices.
Yeah, I might try to move it away from what I do, but I mean, I do my best. I do think, though, the dietary guidelines, I did have a slide that sort of listed a few that the USDA has. Just general things about, stay within certain calorie ranges, eat fruits and vegetables, eat a variety of food, eat nutrient dense food, things like that. So these are general statements about making food choices and things. We do not need to supersize ourselves with, big, huge, giant Cokes and hamburgers and things. I mean, there are foods that you probably know you should eat that you might not have necessarily in your regular diet. But the thing that I'm trying to think about with the My Nutrition Index is, even if I say I'm going to eat, all these different vegetables and fruits, and I'm going to eat whole grain breads, and I'm going to, all of that. There's still a lot of nutrients that I don't really know much about. Somebody says, your selenium is down. What does that mean? And how am I going to fix that? Right. If I adjust one thing going up and something else is going down in terms of nutrients, that's hard to figure that out. Right. So that's why I think diet starts complex, because it's so many different ways that we like to eat. It's related to our cultures and our, what's home to us. And I mean, there's so many mental things about the way we eat and sitting down with people and sharing meals and things, which is so important to wellness and to life, health. But at the end of the day, being able to make decisions about improving that takes into account all these different dimensions in terms of food choices, it seems to me it's easier to think not just in terms of food, but let's go down into a smaller dimensional problem, and that is the nutrients. And that's, I think, a lot of what's out there in terms of guidelines are food-based, because that's easier for people to understand. But what I'm trying to do is to create something where you tell me your food, but then the calculations are done underneath in terms of the nutrients that take into account sort of trying to improve to all levels, to all of these components together, not just focusing, say, on, protein and calories or, whatever, just the macronutrients or something. So Vanessa, I don't know if I answered your question there, but, I think it's complicated, and it really boils down to, I think, are people motivated to make a change? And if they are, can we give them the tools that help them do that, right?
Yeah, exactly. And it sort of leads into my next question, which is related to a question that one of the guests has, which is, you're crunching the data so that we know what to do, right? You're crunching the data so that we can sort of take all of that data and have some broad-based conclusions around, if I go in this direction, it's probably not going to improve my health. And if I go in this direction, it's going to be a little bit better. And so one of these questions is, the idea of having a target number, something simple, rather than tracking many nutrients, sounds incredible. Can you explore how you are defining a low number versus a high good number? And I would add a little bit more onto that, which is, how do you think about what's your vision for what that might look like practically in the world, right? Like, is it an app? Is it a public policy recommendation? Like, how does this research translate into, real information and tools that are simple and easy to use that we can all use to improve our health outcomes?
Yeah. Well, I'm a researcher. So right now I'm in that research phase, right? My first step is to try to create this index. And the first thing is it really a metric that people ought to be using, right? Just because it sounds like it would work, does it really work? And so I'm in that phase now, trying to say, this index seems to be a metric that does track with the way you think it ought to. It ought to be the case that, well, certainly working with Laura Manning and Lori Kiefer in that IBD study, that was really fun, thinking about people, and these are sick people coming in. I mean, these are young adults with really hard lives that they deal with, right? How do you make incremental changes in their dietary patterns that could help them maybe feel better at some points in time, right? And then I'm gonna come back and talk about the metric itself, but I got into this back in the day when I was in Richmond. There was a pancreatitis doctor I was working with, and those patients are really sick. And he said, Chris, these patients, they're afraid to eat because if they eat the wrong thing, they have these horrible side effects. And he said they eat Jell-O. I'm thinking, that can't be good for you to only eat Jell-O. How can that be healthy? I mean, we need our food as a to protect us and to keep us healthy. So to me, it's nutrition is a broad food choices. It's not just, let's just eat Jell-O. You know what I mean? And I'm not trying to disparage people that are in that kind of situation and the decisions they make, but I'm just saying, if it is the case that you can come up with a metric to help them make decisions, then that would be fabulous. The index itself, though, it's based on regulatory guideline values. So as long as you're in, and that's very specific to an individual. That's the whole point, right? The guidelines, it's not just one size fits all. It is, how old are you? What sex are you? What's your height, your weight, things like that. There's all these different components. And those components are different for different people in the sense of, are you pregnant or not? Do you smoke? Do you have hypertension? All those sorts of things. That makes your situation different than somebody else's. So those guidelines change for you based on those characteristics. So the higher the number, it means if you have a number, generally I would say between 90 and 100, then most of all of those indices are in pretty good shape, right? The lower numbers are saying you might be inadequate. Now, some of the nutrients like salt, you could have too little and you could have too much. So, but that's also incorporated, right? If you have too much, it's not good. If you have too little, it's not good. So it's just that sort of right in the middle. If you're in the middle of where it needs to be, right, then that would give you a higher score. So it's combining all of those things together in a single index is the way this works. And it's on a scale from 0 to 100. And you saw that histogram, where many of the people are eating around a 70 is about the average, I think, upper 60s, 70s. But there are people that have, and a lot of those really low values, I think, end up being, salt issues and things. But that's not always, I shouldn't say that. I don't know that for sure.
So thank you for addressing the fact that it takes into account, sex, age, all of those other factors. have you considered, a couple of questions came in about organic versus non-organic, and also farming practices in terms of, fatty acid content, grass-fed beef versus industrial feedlot. And does that play into your research in terms of nutritional values of different types of food grown in different ways?
Yeah, I think the organic part might end up giving you more nutrients. It might be more nutrient dense than otherwise. You might avoid some of the, pesticides that go along with things that could be an adverse thing, but that's not part of the index except through if that's in the FNDDS data set that links nutrients to the food items, right? And I do think there are in the FNDDS data set, there are different, you can say I ate this organic or I didn't eat this organic, right? So there could be different nutritional values that they've identified that is part of the index. So that could be part of that. I'm not going after that particularly, but I think some of that could be incorporated, again, based on what's in that data set.
Great, thank you. We have a question about the fact that we know that lower income communities of color experience higher environmental exposures and have less access to healthy foods. Have you considered how this index could help to inform policies to help those populations? Again, I know you're in the research phase, and probably the next step is really implementing, but have you thought about ways in which that could be impactful in informing public policy with respect to those?
Yeah, I don't know about public policy, but we are doing this hasn't been published yet, but we're doing an analysis of some data. It's called the SHOW study from Wisconsin. I can't tell you what it stands for. Anyway, it's health, it's adults in Wisconsin, but we're looking at microbiome of patients and our subjects in that study with the My Nutrition Index. And the thing that's really interesting about that is we've got food security and food insecurity measures in that study, and we are able to show that the My Nutrition Index distribution is different for those with food security versus food insecurity, which is what you would anticipate, right? Unfortunately, if you don't have access to good, healthy foods, then the nutritional value is going to be lower. And so we can demonstrate that with the My Nutrition Index. We are also seeing, though, that the food insecure people have much broad, well, I shouldn't say much, but have broader, let me just say broader microbiome associations to nutrition compared to those with food security. And, that's still wide open research about, why that would be the case. But it does address your question, I think, Vanessa, about, food deserts are a problem. And so maybe having a metric, sometimes policy making, they need to get things down to a simplified level. And I do think having an index might help people visualize what we're talking about, right? So if we really can show that the My Nutrition Index is a way that does track with the dietary nutritional value, right? Then to show that people in a food desert tend to have lower nutritional value, that's important, right? That's something that maybe people could sort of champion in terms of their communication with policymakers.
Absolutely. I think we have time for one or two more questions. Obviously you're running a lot of statistics and you're gathering big data. I think one of the most interesting things about your work is this looking at mixtures versus one pollutant at a time, taking everything and weighing it and saying, what should we be paying attention to? And then overlaying those exposures with the My Nutrition Index to find this three-dimensional sort of understanding of how everything is impacting us at the same time. It's one of the things that has drawn me to the Exposomics Institute, is this sort of newfound approach to really look at using so much data to figure out what should we pay attention to in a sea of information. And so can you talk a little bit about how your research has changed and how it's different than the way environmental health was conducted maybe decades ago, where we were looking for, the one thing, and then we did lots of studies on that one chemical to determine that it was harmful, and then we moved on to the next one. The approach feels so different today.
It does in some ways, but unfortunately, it's not fast enough to my mind. I've been around a long time, and I have seen, regulatory things focus on single chemicals, and then they start building cumulative risk assessment for mixtures of chemicals, but they're limiting to combine chemicals that act so similarly. They called it the mechanism of action had to be the same, and then it was the mode of action, but largely just to say, oh, we're only going to put chemicals together in our mixtures based on their properties, their chemical structures. That's not how we're exposed, right? So anyway, so that's been sort of that part of it. We've recently, though, started doing some work. We just did a webinar a couple of weeks ago on a paper. We had a science paper come out from molecules to cohort or something like that. But it's largely trying to show another way of doing a risk assessment based on mixtures, where you can take epidemiology data, do experimental evidence, and then come back and say, well, now what does that compare to human exposures, this mixture, a typical mixture. So we've been doing that kind of stuff. It's been really interesting. So I'm happy to share that webinar link with people. If it was a recorded thing, I'm happy to share that. But yeah, but right now I think the resilience part of potentially the resilience part for better nutrition, I think needs to also be there, because it does feel like something that you can take control of. And I think just from a wellness perspective, sometimes you just feel so overwhelmed with all the things that are out there. If you can say, well, at least I can control this. That might be a nice thing for people to be able to do. So that's, we'll see, but that's where I'm trying to get to, is where people could maybe think of this as an index that can help them in terms of their diets.
Yeah, well, it feels like you're part of that change, moving us forward to really looking at exposures the way they happen to us. And so that sort of leads me to my final question, which is, what is your vision for the next 5 years? What's sort of on your horizon? What are your dreams for your research? What are you interested in really unlocking over the next, call it 5 years?
Yeah, I think I really have gotten more and more into the nutrition side. I would like to start working, there's this IBD, these two women I was telling you about. I'd like to start working more with them and those kinds of things where we can really get, in a clinic, see if this works. I do see myself doing more and more with the nutrition. I also am very interested in science communication. And I think that there's so much out there that people just don't understand. And then we get this, stuff where people are so off the mark in terms of what science is really saying. And that's so unfortunate. And some of that I think has to do with scientists need to do a really good job of incorporating science into our culture. And, that might be getting artists and, musicians and people that to start also thinking about environment, and environmental health as part of what they are presenting back to our communities. But we need to stop, scientists need to stop at the door. We need to stopping just at the paper publication things. We need to be able to really communicate in a way where when people reflect back, just, I'll say crazy talk. It doesn't make any sense what they're saying, but it's because we've left a vacuum. We need to let people understand science better. And I don't know if that's an education thing or whatever, but we just can't let it go. We've got to take control of science and let people understand it's a good thing to have scientists debate issues and things like that. But so that's sort of, it's not so much mixture. I'm going to stay in mixtures and all that, but I really think going forward, one day I'd like to have a barn as a venue where people could come and, let's just all talk together and, and then at the meantime have, goat yoga, whatever it is, just, we're a community, but where we can talk and see each other as people and try to understand each other better. So.
That sounds amazing. Sign me up.
Okay.
We'll open that barn and I will be there.
I've got a friend that's going to make chandeliers out of teacups. So, we'll have a lot of fun.
I love both of those things because they really are empowering to people, right? Empowering people to really understand through this tool their nutritional needs and how they can help themselves. And secondly, yes, there's been a lot of crazy talk and pseudoscience out there, and this idea of really the scientists leading the conversation with
Yes.
the public is really fascinating.
So important. Yeah.
That's a whole, I think that's a whole other
That's
webinar.
a whole other topic. Yeah.
A whole other
Okay.
webinar, which would be fascinating.
Yeah.
Thank you so much, Dr. Jennings. And thank you to everyone who joined us today for this fascinating presentation conversation. I really enjoyed it. One favor, there is a link in the chat to the evaluation survey. It would mean so much to us if you take a minute to complete it. It really helps us to do better and to respond to you and give you what's most relevant and needed for you. Also, this will be emailed to everyone once the recording is available so that you can revisit if you want to. And again, just thank you to the Mount Sinai team for putting this together. And again, to Dr. Jennings, it was really a pleasure. Have a wonderful day, everyone. Thank you.
My pleasure. Bye, everybody. Thanks for coming.